Nutrition and hydration, information for social care staff. 1 in 10 older people are undernourished and 90% of those live in the community. The NHS states that 35% of those admitted to care homes are malnourished. Therefore, it's important to promote good practice and the importance of hydration and nutrition in care, as well as raise awareness of the risks that hydration and malnutrition can bring. Malnutrition means poor or bad nutrition. Most people who are malnourished will lose weight, but it is possible to be at a healthy weight or even overweight and still be malnourished. Service users can become malnourished if they do not eat well for as little as 2 to 5 days, so it's important to regularly review their nutritional needs. Dehydration means the body loses more fluid than is consumed and is usually caused by not drinking enough or a sudden unexpected fluid loss, such as diarrhea and/or vomiting. It's important to frequently assess service users' nutritional and hydration needs to ensure they receive the correct level of support. Assess whether they are independent. Do they need prompting? Do they need assistance? If assistance is required, assess the level that is needed. It's important for care staff to enable service users to remain as independent as possible so that they do not lose their skills. Social care settings have a legal obligation to ensure that service users' nutritional and hydration needs are met. The Health and Social Care Act of 2008 states, people who use services have adequate nutrition and hydration to sustain life and good health and to reduce the risks of malnutrition and dehydration when they receive care and treatment. Providers must make sure that people have enough to eat and drink to meet their nutrition and hydration needs and to receive the support they need to do so. People must have their nutritional needs assessed and food must be provided to meet those needs. NICE Guideline 22 states, under this guidance, care home settings have a responsibility to identify ways to address particular nutritional or hydration requirements and ensure people have a choice of things to eat and drink and varied snacks throughout the day, including those outside of regular meal times. The CQC mentions on the third line of inquiry, how are people supported to eat and drink enough to maintain a balanced diet? Applies to services that provide, prepare, serve food as part of a regulated activity or that support people to do so for themselves. Identifying malnutrition is not always as simple as looking for someone having lost weight. It's important that care providers and families too can spot the signs and symptoms associated with poor nutrition. These include weight changes, lethargy or tiredness, muscle weakness, increased falls, changes in bowel habits such as increased constipation, pressure sores and poor skin, mood changes such as depression, memory loss, cognitive problems or changes in behaviour, and increased infections. Poor nutrition in care has many causes. Older people may forget to eat due to cognitive problems such as dementia. If an older person takes medication for any reason, this also could cause changes to their appetite. There may also be physical challenges to obtaining good nutrition, such as having dentures that fit poorly or having dental problems. Previous strokes or other health problems may have also caused chewing or swallowing difficulties. There may be issues with the physical task of eating too, due to slight issues or being unable to lift cutlery or drinks. Many older people are proud and feel embarrassed at making a mess whilst they eat. All these reasons are important considerations when identifying someone in care who has or is at risk of suffering from poor nutrition. So to reduce the risk of malnutrition, use a malnutrition screening tool such as the Malnutrition Universal Screening Tool or MUST to identify, review and plan, screen on admission and review at least monthly. Implement a nutritional care plan based on their nutritional risk but centered on their desires and likes. Offer a variety of nutrient-dense, high-calorie and high-protein meals. Offer assistance where needed. Allow time. Position correctly. Make them comfortable. Offer encouragement. Make small, frequent meals or snacks available. And protect meal times. Good hydration is vital in care settings. It maintains all bodily functions, including muscles, brain and heart. By maintaining healthy levels of fluid in a body, a person reduces their risk of contracting infections, particularly urinary infections or UTIs. For most of us, urine infections are minor ailments that are treated successfully with antibiotics. However, for the elderly, urinary infections can be very dangerous. They are also much more common as you age. Over a third of the infections in nursing homes are UTIs. Older people are often less aware that they are becoming dehydrated. They do not always recognise thirst, and some may be unable to communicate their need for fluid. Being able to recognise the signs of dehydration is imperative in care. Use your 5 senses to check the signs of dehydration. Sight. Does their skin look dry? Smell. Do they have bad breath? Taste. Do they have a dry mouth or cracked lips? Listen. Are they confused? Are they complaining of a headache or feeling dizzy? Touch. Does their skin feel dry? A quick way to check how well hydrated the service user is to check their urine colour. A laminated urine chart on the back of the toilet door will help you or the service user to assess their hydration levels. Do you know how many millilitres of fluid your service users should be having each day and how many millilitres are in each drinking vessel? It's recommended that 6 to 8 drinks should be consumed daily, which equates to about 1500 to 2000 millilitres. A standard cup will contain 150 millilitres and a standard glass 200 millilitres. A standard jug 1000 millilitres. It's important to note that not all residents will be able to have 1500 to 2000 millilitres of fluid a day due to certain medical conditions. Check with their GP or consultant to make sure they're not on a fluid restriction due to their condition or medications. To support good hydration, consider allocating staff to support and monitor what service users are drinking, whether some service users have a favourite cup or mug that helps them to drink independently, using a fluid balance chart to help keep track of the amount of fluids being consumed in a day, using a fluid balance chart to help keep track of the amount of fluids being consumed in a day for those who have to restrict their intake or for those who have concerns for. It will also help to identify any problems with urine output. Remember that eating and drinking are social activities, and the right environment should be created to make eating and drinking a pleasant and relaxed experience. The acronym MEALS is useful for remembering the key aspects for encouraging good nutrition and fluid intake. Manage the environment to allow people to eat in a welcoming, clean and tidy area. Ensure a relaxed atmosphere to enjoy the meal experience. Assist people who might require help in eating and drinking. Limit non-essential interruptions to focus on providing support at meal times. Staff and visitors recognise the importance of mealtimes as part of basic care. To raise the profile of nutrition and hydration with staff and service users, consider having a nutrition and hydration advocate or champion. Asking the chef to visit the resident of the day to choose a favourite meal or drink and to understand dietary preferences. Discussing nutrition and hydration concerns at daily handovers, and setting up nutrition and hydration quarterly meetings. Poor oral health can have a negative impact on eating and drinking and should be regularly assessed. Complete oral health assessment on admission and regularly review for any tooth decay, mouth sores, loose teeth and ill-fitting dentures. Assess if any eating or drinking problems are caused by poor oral health. Reduce tooth decay by limiting the intake of sugar to 2 or 3 times a day, preferably at meal times, and encourage drinking of plenty of fluids, at least 6 to 8 glasses a day. We hope that you found this video useful and informative. Links to a number of the resources mentioned earlier in the video are available in the video description below. Thanks for watching.